So welcome to session 4 of our day focused on building men's health literacy and men's health promotion as part of the Men's Health Connected online summit, which takes place throughout this week. This is day 2 of 5 days. And this is our final session today, which asks the question, men's health and sport, is it the perfect team? So we've been talking about men's health literacy. We've been talking about some of the principles of health promotion to men. And in terms of really engaging with men and connecting around health initiatives, one area that is, to my mind, a little unexplored, but has some really excellent examples of good practice is the world of sport. Sport, which can broadly mean not just competitive sport, but recreation and exercise. Sport is increasingly being used, and sporting communities are increasingly being used as a way of meeting men where they are and meeting men around their interests. And as we know, men are often to be found in sports stadiums or playing sport or watching sport. It's an interest that many men have. And so our 3 speakers today, coming from the world of AFL, the world of what I will uncomfortably refer to as soccer, and the world of community-based sport, are going to talk about their projects as we explore the question, men's health and sport, is it the perfect team? Coming up, we have Dave Burt from SALT, which stands for Sports and Life Training, which engages with people through local sporting clubs around a range of health and life training initiatives. We have Tim Budden from Man v Fat Soccer. Hopefully you should be able to work out what that's about. And first up, we have Associate Professor Eleanor Quested, who works on the Aussie-FIT program, which focuses on AFL fans. Eleanor, over to you.
Thanks very much, Glenn. I'll just share my screen. Can you see the opening slide?
Not yet.
Okay. All right.
There we go.
It would be a Zoom call without some technical hitches, would it? So yeah, thanks very much for the invitation to speak today. It's great to join you over here from Perth. And yeah, before I begin, I'd just like to acknowledge the traditional owners of the land I'm presenting today, the Whadjuk people of the Noongar Nation, and pay my respects to elders past, present, and emerging. So last year, I actually presented at this forum as well about the Aussie program. And in that presentation, I talked through the findings, the effectiveness findings of our Aussie-FIT men's health program in terms of how the program was effective in improving weight status, health and well-being of men that took part. So today, in case there's any repeat offenders in the audience, people returning again, I'll be talking about something slightly different. I'm going to talk about some of our learnings from that study via process evaluation. So really where we try to explore how this program facilitates change, what are the mechanisms via which it has been able to be effective in helping men to change their health behaviours. And then I'll also talk a little bit just at the end about where our team's work is now focused. So just very briefly, I'm sure many of you are aware of some of this information. Why are we undertaking this line of work? Well, as we know, there's a pressing need to address the disparities in health for men, including physical activity, poor diet, obesity levels, and also risks of physical activity, of physical and psychological ill health. So the prevalence of many of these health concerns is far greater in men than in women in Australia. And really for quite some years now, it's been noted that weight management research that focus on men is hugely in a minority. 20% is of RCTs, one review paper showed. But that has been changing, certainly within the last 5 years and more, 5 to 10 years. And there's growing and really quite compelling evidence now that shows that men are willing to take part in weight management interventions, but when they've been appropriately tailored to appeal to men's interests and to meet the needs of men. So one of the sorry, I think I've jumped forward a slide. So yeah, so how do we change? How can we make sure that interventions are most effective in changing men's weight? Well, if the research has been conducted in weight management, physical activity and eating behaviour change, there's now really good evidence base that tells us that for interventions to be effective, they need to be based on a theory, so have kind of a strong grounding as to what's expected to happen. They need to be designed to align with men's values and interests. Group-based interventions tend to be more effective, and they need to include multiple behaviour change strategies, so techniques to support men to change their behaviours. And there's a couple of good recent papers have really supported that these types of characteristics can help interventions to be more effective. And one body of work that I'm sure many of you will be familiar with, that's really helped to build this evidence base, and there's an array of papers by Hunt, White, Gray and colleagues on this work, is the Football Fans in Training programme. So this was initially developed in Scotland just over 10 years ago by these colleagues, and after rigorous trials it's ongoing in multiple soccer clubs, football clubs as we'd say, but soccer clubs in Scotland. So this was an intervention delivered in Premiership football clubs to support men to manage their weight. So building on this programme and in close collaboration with that team, with funding from Healthway a few years ago, we developed an Australian version, Aussie Fans in Training, which is culturally sensitised and adapted to appeal to men in Australia. And we delivered this in 2 AFL clubs in WA. We delivered this in the Space Eagles and the Dockers contexts. So as I mentioned, I presented the overall findings from this last year, but on the screen now you can see those QR codes will take you directly to the papers with the results there, and I'm happy to share those at the end as well to anyone's that is interested in looking at those. Actually, they're open access, so they're easy to access. So these, as we'll see from the results of that trial, the Aussie-FIT programme was effective in helping the men to lose weight, to become more active and to eat better. And we also saw improvements in well-being. But it's important to understand then not only if programmes work, but to try to understand how they work and really to understand what is it that helps them to appeal to men. And this is really important, of course, for developing new programmes or for extending existing programmes to other settings or contexts. So just some context for what Aussie-FIT is, for anyone that's not familiar with the programme. So Aussie-FIT was a 12-week long programme. It is a 12-week long programme of 90-minute sessions, which we delivered in football clubs, delivered by coaches from the clubs who were trained by our team. So over the course of the 12 weeks, it works out, those 90 minutes work out as roughly 50-50 of education to group-based physical activity. But that changes as the programme goes on so starting off with less activity and then building up to align with men's changes in ability and competence and their confidence. But the prominent physical activity habit that we were trying to develop in Aussie-FIT was the activity that they do outside of those weekly sessions. So we focused on regular independent walking using a Fitbit to self-monitor. But the guys could pick any activity they liked. So really those group-based sessions are about giving guys the opportunity to become more able at physical activity, to develop that confidence and awareness of other types of activity that they might do. And I think importantly, we wanted to them to have an experience of enjoying physical activity. I think if when you haven't been active for a while, it's not always that pleasant to become more active, and it's good to really get an experience of enjoying that if you want it to become a part of your lifestyle longer term. So the aim then was at the end of those 12 weeks, the men are better positioned to continue their active lifestyle in doing something that suits their preferences. So in other words, to maintain that behaviour change. Oh, that came up a little bit late. The themes that we targeted to promote behaviour change maintenance within Aussie-FIT are described in quite a lot of detail in our process evaluation, but just briefly, I'm presenting these to you on the screen now. So these could be considered mechanisms that we'd hypothesise would lead to the intervention being effective. A great study by Kwasniewska and et al. In 2016, a good review study of many of the behaviour change literature revealed these to be highly prominent mechanisms in promoting behaviour change, and these were central to our Aussie-FIT programme as well. An important aspect for us as well was, and particularly my research interests, the self-determined motivation part as well. So there's really strong evidence that when we have a more self-determined motivation, we're more likely to sustain behaviour changes. And somebody leading an intervention, like a coach or a healthcare worker or a leader, plays a really significant role in influencing that motivation. So we incorporated into the Aussie-FIT programme some basic principles of self-determination theory. These were incorporated into the programme activities and also the activities that in which we trained the coaches. So we're looking to promote a motivation that's based on feelings of enjoyment, satisfaction, and accomplishment. And there's a bit of a misguided view, I guess, that if we want to motivate, we need to use carrots and sticks, such as pressurizing people, instilling fear. If you don't change this, all these horrible things will happen to you, or using carrots, points, prizes, praise to kind of entice people forward to bring them on the journey you want them to go to. But research evidence really shows us that although these types of strategies can be effective in the short term, it can be costly for well-being and actually won't lead to sustained behaviour change, because as soon as the carrot or the stick is removed, the behaviour will cease. So in Aussie-FIT, we were looking for that long-term motivation, and based on self-determination theory, we focused on training the coaches to develop these three so-called psychological needs, which are the nutrients, if you like, to promote that more self-determined motivation. So the coach training really emphasised how they could develop the competence, the autonomy, and the feelings of relatedness of the men who took part in the programme. And we also helped the men to become more aware of their own motives, and to try and prevent death by theory. And we gave quite a simple concept for this. We just referred to red and green motivation, and talked to the guys about the importance of developing and fostering their green motives, and made them aware of some of those red motives. So sometimes it's the red motives that get us in the door, that get us going, but to keep going, we really need that green motivation. So that's, I guess, the background. And in the process evaluation study that we did, we really wanted to look at how some of these factors, or if some of these factors might have influenced intervention effectiveness, and how our intervention might have facilitated the change that we saw. So our process evaluation was actually multi-component. We used a range of data types, including interviews, observations, surveys. In the interest of time today, I'll just focus on kind of a few of those aims and some of that data, mostly the interview data. So we really wanted to look at the feasibility of this intervention becoming established in Australia, to explore how acceptable it was to the men and the coaches involved, and importantly to explore those mechanisms of impact, with a particular focus on the things that we added to Aussie-FIT that weren't included in the original Football Fans in Training programme. So I won't go into the method in too much detail, because you can read those things in the paper if you're interested, but suffice to say, we conducted 6 focus group discussions with 24 of the guys who'd gone through Aussie-FIT, and we interviewed 4 of the coaches in in-depth individual interviews as well. And these are recorded, transcribed, and analysed with a reflexive type of thematic analysis. So from that analysis, we developed 6 themes overall, but I'll talk you through 4 of those themes now. So our first theme, it was location, 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 which really centred on or kind of complemented the previous research findings by Archibald et al. And Hunt et al. That we need to ensure locations are both congruent with masculine identities, but also convenient if they're going to attract men to health interventions. So some participants described the AFL club setting as vitally important in their decision to attend the programme. But for other guys, such as this quote here from Todd, it wasn't always that important at the outset. But actually, as the programme went on, it became something that might give him, kind of keep him coming back. So for men that were less interested in the setting at the start, this, being in the football stadium, in the place where the Dockers train, can become more important as the programme continues, which really supports what was found in the Scottish programme as well. Another aspect of location, though, was because of the geography of WA. We only have 2 AFL clubs that are in the metro area of Perth. So guys actually ended up being kind of hooked in to want to attend the programme and travelling quite a long way to be involved. So we didn't get a situation where we had local guys, all from the same town, running into each other and able to stay connected longer term. And as this guy here says, it was hard enough getting everyone down here once a week. You're not running into people at the local shops and able to say, okay, let's go and let's get together. So there was much discussion in the focus groups about the possibility for Aussie-FIT to be run in local communities, and also if it's to benefit more men in Australia, given the geography that we have, we need to look for other models that aren't dependent on professional sports settings to enhance that reach. Looking at those mechanisms then of behaviour change, just focusing now on the internalisation of motivation, so moving that motivation from red to green. The coaches felt that programme content was really quite relevant and quite easy to coach. They talked about the structure being there to teach them well. They're also on board, really, I guess, with the idea that motivation played a pivotal role in the programme. It was one of the core pillars of the programme. And as Coach Martin here says, you can teach all of the wellbeing stuff, the other stuff, but it's not going to be maintained without that core. And the guys and the coaches as well both described how they found the red and green kind of construct of motivation quite useful in giving them an understanding of, but also the vernacular, the language to explain the shifts in motivation that they experienced themselves. And as Luke says, he went from, instead of doing it for the wife, the idea is at the end of the course, you came because it was fun and you wanted to do it. And that was how it felt for them. The next part, the next theme that became quite prominent from the interviews was around the topic of competition and whether competition could be a double-edged sword. So, competition is obviously an inherent part of sport, but in terms of its role in motivation, I guess we need to think about how we manage that to ensure it's not going to undermine the internalisation process of motivation for some people who may be more likely to compare themselves to other people. I think this quote here from Colin really illustrates this point. He said at the start he was really anxious. He was comparing himself to everyone else, and he was seconds away from walking away. He could have pulled the pin, and it wasn't until other people emphasised for him it's about working with people, competing together, working alongside them, that helped to keep him in. So we also found, though, that coaches talked about the benefits of healthy competition, and competition certainly one of the things that makes fun. So it's I guess a delicate balance to ensure that coaches can maximise the opportunity of using competition to create team spirit, to create challenge and fun, but to ensure it's not going to be problematic given the inherent tendency some of us have to compare with others, and not to overemphasize that comparison as well. Then finally, the interview data really highlighted the importance of small, sustainable changes for developing habits. So this was reflected in the men kind of noticing in themselves that suddenly they developed a habit that they hadn't realised. So as this guy Ricky here says, it's ingrained over time. I didn't expect it, and then by week 10, you realise actually the program's done what it's meant to do. You're doing this stuff by doing it habitually. And I think just seeing that the participants recognised that it was it wasn't just do this for 12 weeks and you'll be fixed. It's small sustainable changes that are important for developing habits. And there's vast literature on the science of habit, and as that shows, habit formation is really necessary if we want health behaviours to become more automated to respond to contextual cues and be things that people are able to continue. Another one, I forgot about that one. So Mark here is one of the coaches as well, and I think this is quite a nice point that he makes, that actually the education sessions were more important, and that part of the program was more important than the football in some ways, getting these healthy habits developed. The footy was the hook, it got them in the door, but maybe help them to come back next week, but developing these skills were good for long term. Just to wrap up then, some concluding thoughts. I've presented some of the findings from this paper today. You can access this as well via the QR code, or I'm happy to pass it on. But essentially some conclusions just to share from what I've talked about today. I think we really found through these interviews that the Professional Sports Team Association and the footy focus is highly appealing in WA, just as we've seen for this style of program in other parts of the world. But I think including the additional content related to motivation, the behaviour change stuff, also some parts on peer support, which I haven't presented today, we're starting to show through as some of these mechanisms that are really important components to have in interventions when we're trying to change behaviour, to produce some of the positive effects that we've previously reported. And finally, as I touched on earlier regarding context, given the lack of population density in many parts of WA, the scarcity of clubs, we need to look at other options for how to deliver this type of education and health behaviour change more widely. And that's actually something our team are doing now as part of Matt McDonald's PhD, and with funding from the Department of Health. We're trialling a rollout of a programme not delivered in professional sports settings in some areas of WA. And just a final plug as well, we're also doing some work to adapt Aussie-FIT for men with clinical conditions. So from next week, we'll start delivering our first programme specifically tailored for men with cardiovascular disease. So that's pretty exciting as well. But I'll leave it there. I'll leave you with one of my favourite quotes regarding the benefits of peer support that I didn't talk about today. And thanks for your attention. And if there's time, I'm happy to take some questions.
Thanks, Eleanor.
I just feel still there.
And yeah, thanks, Eleanor. It's great to get an update on where you're at. Good to see such rigorous analysis of what's working and why it's working, and to hear about some of the new potential directions as well. I'm going to ask people to drop questions in the chat box because you've got a little bit over time there, and also I'm showing signs of mental Zoom fatigue and completely forgot we'd introduced a fourth speaker late on, who was sitting there thinking that we'd excluded him. But we've got the bonus of so Eleanor will maybe come back to you a bit later with questions, but also keep a spot in the chat box. Great way to get started with that focus on footy. And next we've got, announced for the first time, Dr. Lee Ashton. So Lee's been working with Professor Phil Morgan over at the University of Newcastle, who's been doing a range of awesome programs over the last few years, engaging fathers and their kids in different types of exercise program. Dr. Ashton himself is an early career researcher. He works in the Priority Research Centre for Physical Activity and Nutrition at the University of Newcastle. And at the moment, he's working on scaling up several of the family-based lifestyle programs that target dads and their children to improve their health. We've only given you 10 minutes on this occasion, Lee, but thanks for being here, and thanks for not taking it personally when I didn't include you in the initial roll call.
Thanks for that, Glenn. No worries. Just thought I'd been booted last minute, but yeah, glad to present on this. I was just trying to share my screen, but it's saying the host's disabled participant screen sharing.
We'll get that sorted very promptly.
Yep, yeah, my bad. Should be all sorted now.
Legend, thank you. Okay, can you all see that? That's not good. Okay, good afternoon, everyone, and thank you for inviting me to present on our Daughters and Dads Active and Empowered program, which is the world's first family-based lifestyle program targeting both fathers and their daughters. And a common question that we get is, why have we created a program specifically to daughters and dads? You know, why haven't we involved mums and sons? So I'll start off with girls. So we know that in Australia, girls are less active than boys at all ages, and they have less encouragement and opportunities in sport and physical activities than boys. And as a result, there are huge differences in sport skill proficiency between boys and girls. And as you can see on the chart on the right, here is those which have reached mastery level for the fundamental sport skill overarm throw. So you can see a big difference there. And alarmingly, less than 1% of girls have mastered the 6-4 key sport skills before they leave primary school. So that is kick, catch, bounce, strike, overarm throw, and underarm throw. So why is this the case? Well, there are many barriers that affect kids' ability to be physically active. But for girls, you know, there are so many more challenges, which results in that steeper hill, as you can see there. And we encourage girls to be confident, courageous, and bold, but we're sending them into a hostile environment. So for the Daughters and Dads program, you know, we're trying to address some of these barriers to reduce the steepness of that hill. And then we want to help girls even more by providing them with the awareness agenda bias, critical thinking skills, improving the physical skills, and most importantly, the father support. So our girls need to be empowered, but they also need strong male advocates. And that often comes in the form of the father or father figure. So fathers have a powerful and unique influence on their daughters' lives. The emotional bond between fathers and children has been described as an activation relationship, which often develops through physical play. So the masculine interaction style, which is the physical, unpredictable and stimulating play, enhances the cognitive, physical and social emotional outcomes in children. But the problem is girls often miss out on this. So the powerful father-daughter relationship can be heightened during these 4 key areas. So fathers are more likely to initiate, enjoy and sustain that co-physical activity. Dads usually provide a good demonstration of skills, which the daughter can learn from and mimic. They are also more likely to encourage risky play, which is good for the developing brain. And also for the last one, which is rough and tumble play, it's really important for brain development and self-regulation of behaviours and emotions, but also conditioning for many sports. So dads can control, but the daughters are working hard for the win. So it prepares them for the potential physicality that they may face in sport. So this image connects with many fathers. So girls are often born with this predefined destiny. For example, girls don't like sport. And as a result, dads are spending less time in co-physical activity with their daughters than sons. And there's also a low father involvement in parenting programs. So a recent review of over 280 family-based lifestyle programs found less than 6% involve participating fathers. And this is why we created the Daughters and Dads program. So here's an overview of what we provide in that program. So it's a 9-week program to either fathers or father figures to primary school age girls. It includes an initial 2-hour workshop, which is specifically for the dads. And then we have 8 weekly group-based daughters and dads sessions, with 30 minutes of that session involves an education session, and then a 60-minute practical, which covers the rough and tumble play, fitness exercises, and sport skills. And then we provide them with a home program, which encourages that co-physical activity when they go home. So in the dads only session, we focus on physical activity parenting and co-physical activity, and how to teach sport skills, ideas, and strategies for fun co-physical activity. We emphasize the role of the father and that dads matter in the daughters' lives. And we also cover pinkification. And this is the gendered marketing where girls are bombarded with pervasive cultural messages that value girls for how they look rather than who they are. And that ultimately affects their self-esteem and body image. So we encourage the dads to be equalist parents for their daughters and sons, and to honor their daughters' unique experience in the world and let her define femininity in her own terms. And dads learn to teach their daughters that bodies are instruments, not ornaments, and that colors are for everyone, toys are for everyone, sports are for everyone, and careers are for everyone. Then for the group-based daughters and dads session, we look to empower the girls with positive psychology, and we introduce social emotional skill focus of the week. As you can see on the right-hand side, that's what we cover each week in the word of the week. But if I just divert your attention to the image on the left. So within the session, it's a really special opportunity for the daughters and the dads to engage in meaningful conversations. What do you think that girl is thinking there as she's looking into her dad's eyes? I was actually at that session and I know exactly what she was thinking. She was thinking, so glad this program operationalizes principles of gender equity and evidence-based sport pedagogy to optimize my motivation and enjoyment. So the program has been running since 2015, and we've demonstrated significant and large improvements in a number of outcomes for both fathers and their daughters. So we've seen improvements in physical activity levels in both fathers and daughters. We've also seen improvement in parenting practices and reduction in screen time. But I think what's most important is we've seen benefits in the father-daughter relationship and the social emotional well-being in the daughters. So due to the success of the program, it's recently been named as a key initiative in the Her Sport, Her Way strategy with the New South Wales Office of Sport. And the program is currently being rolled out statewide through sport and recreation centres. It's also being rolled out in the UK in partnership with UK Women in Sport. And we've also created sport adapted versions of the program. So we've just done the first pilot phase of a cricket version of the program. We're developing the basketball version, which will run at the end of this year in line with the Basketball World Cup in Australia. And then next year, we'll be looking to do a soccer version of the program. So far, we've reached over 1,000 daughters and 1,000 dads, with many more coming up. So I'd just like to end this presentation with a quick video which really captures the essence of the program. Okay, thank you everyone. Gives me goosebumps every time I see that video. But yeah, thank you all for listening to that presentation.
Thanks, Lee. I assume I wasn't getting sound on that. The visuals were hypnotic. Mick Soso posted a link to the video on YouTube if you want to go and see that if you weren't hearing the sound as well. But it's beautiful, even just with the visuals. Really interesting talk. I was in two minds about whether to include this talk in today's session or whether we should have just focused more broadly on dads and kids. But I think it's a really one of the really interesting examples from gender and health that's benefiting both males and females. We haven't got time for a big discussion on this today. I know there's lots of questions that arise from this for me. One of the big ones is just the question, because it's clearly been hugely popular, and I wonder if it's hugely popular because of the daughter's part, the dad's part, or the dads and daughters part, and whether a dads and sons program would grab as much support as this. As an interesting question there, but there's absolutely no doubt about the impact, and anyone who's a dad of a daughter like I am can't help but be moved by that as well. Lee, if you could pick up the questions in the chat box. We're running a little bit behind schedule. I'm going to go. Thank you for joining us at such short notice, and I'm going to go back now to overweight men with our friends again over in WA. At the Man v Fat soccer program. Yes, I can have the word soccer come out of my English mouth. The Man v Fat soccer program. We've got Tim Budham. Tim's research focuses on understanding men's health engagement, and during his PhD, he evaluated the Man v Fat soccer program, which is it is what it says on the tin. It's a sport-based program that works on weight loss in men using soccer as a vehicle to engage them. So, Tim, over to you to give us an insight into the awesome Man v Fat soccer program.
It is what it is on the tin. I think that's the presentation done. Just quickly, I absolutely loved that video, even without sound. It was quite moving just to watch that. I remember hearing about the Dora and Dad's program over coffee, and it made me realize a lot of things I hear about are over some beverage, which will make more sense in a moment. Can we all see that? Is it working?
Yep, we can see it. Yeah.
Right. So I'm really glad to get a chance to present on behalf of the research group I'm part of, the Psychology of Active Healthy Living group, and the organization Man vs. Fat Soccer. As Glenn said, it does say what it is on the tin. I'm not sure why everything's not up there. Just as a brief background, for people who were here earlier, Glenn mentioned a guy called Andrew Shanahan, and the program started 2016 when a guy called Andrew Shanahan tried to lose weight, joined things like Weight Watchers, and found that it wasn't particularly that attractive an option for a guy like him, who was a bit of a bloke and noticed himself being one of maybe one or two guys in a room. So he partnered with an organization called Thrive Tribe, and they first developed a book, a sort of manual of weight loss called Man vs. Fat, and then that snowballed into a program. The next step was my supervisor, Ben Jackson, was on, he's a loyalist to the UK, and as a British man, the one thing that he loves most above all is football. So he was listening to a podcast about football on his ride home, and he heard someone talking about this great program that got these blokes together and they played a game of football, and the result of that match was based on both the game and whether they lost any weight. And then my story, my involvement with the program happened, as all stories should start, with a pint at a pub where he showed me a little clip of the program, and I was hooked immediately. And it was because it was so obvious what the program was about. It's so simple. On the slide, a lot of the information about the program is captured. It's an elegantly simple program. Guys join random teams, and they, as a team, play a weekly game of football for 30 minutes. The result of that game, as I said, is based on the points they score on and off the pitch. They're awarded for any weight loss. So they could lose a kilo, they could lose 100 grams, and they've scored some. And then there are some subtle behavior change techniques that are built into the program rather than being very explicitly presented to players, such as a handbook. And they have also some things like a team and league WhatsApp group where they get to share advice with their teammates. So there's social connection. And it's really good that I got to talk after Eleanor, because she covered basically the problem, and no one in this forum, I think, would be unfamiliar with the problem. The way I like to think of it is men are, quote, hard to reach, but it's a little bit of a chicken egg problem. We can either view it as because they themselves are uninterested in health, and I'm not sure that that's the most productive way of thinking about it. The other way of looking at it is that programs tend not to work with what men particularly desire. And as Eleanor mentioned, particularly back in 2012 when a review was done on this, relatively few programs are explicitly tailored towards men. And that has changed, with notable exceptions being footy fans in training and the variations of that program. But what we noticed about this program was, whether it was incidental or intentional based on the development of the program, is it seemed to tick a load of boxes that a load of reviews said about the best ways of attracting men. The one that I want to point to most of all was the fact that it seems to use physical activity as a lure, a bit of a carrot, and then diet modification follows, because guys find out as they join the program that the only way for them to actually lose weight is to do a little bit more than just play the game. So I'm broad strokes covering what we did in one slide, because I want to dig into one particular thing. We did 3 studies in my PhD. The first one's published, and I didn't put up a QR code. I didn't think that far ahead, but we went to the UK. I got to go to the UK and, again, drink beer in pubs and talked to men on the program about what it is about the program that worked. And they highlighted a number of things, all the way from competition, which has an asterisk, and also Eleanor covered that perfectly, because it is definitely a little bit of a double-edged sword. Players also really positively regarded the idea of being accountable or being responsible to their teammates, which is interesting because it's fundamentally an arbitrary group of blokes that they end up playing with. And almost across the board, people refer to that as a positive element of the program. And all of that leads to this feeling of camaraderie. So what we decided then to do was see if we can move the program to Australia. We conducted a feasibility evaluation of the program. And of course, a feasibility evaluation doesn't mean that we had a control group. So we have to take some of these findings with a bit of a grain of salt. But we looked at 7 leagues in the program. We had about 400 men in that feasibility evaluation. And on average, players lost about 5 kilos. So the program works, and it works rather quickly in 14 weeks for quite a lot of men. And we also saw some pretty good preliminary insight into some of the outcomes. So not only were they losing weight, but obviously they were increasing their physical activity, almost doubling it, changing their diet. And we saw some really important improvements in things like mental health, depression, anxiety, stress, and positive body image, which isn't measured that often in men's research or research on men. Now the program's going even further. We have 11 leagues throughout Australia. The majority are in WA, but we have a few. I think we have one in South Australia and one in Queensland as well. And we've managed to help Australian men lose the equivalent of the weight of 2 rhinos, which is an interesting reference point. But that really, in a really cursory way, that covers what we've done. And I'm happy to talk about that more in depth later. But one of the really interesting things that we saw in the literature, in our very early establishment of the program here, and in our study in the UK, was Banter or Humour plays a really important role in the program. So I'm going to dive into that now. What I liked about the little the bit in Lee's presentation was a really good example of a certain type of humour, affiliative humour, really playful, no butt of the joke. But we need a little bit of a background on what exactly the theory of humour is. And this will be quick. There are 3 very popular notions of what humour is, or what predicts humour. First being the kind of Freudian relief notion, which is you build up tension and release it, like popping a bubble. Then there's the idea that that goes all the way back to the Greek philosophers such as Plato, which is humour is fundamentally scornful. It's based on superiority. So you can't make a joke unless it's putting someone or something down. And then more recent theories say that it's incongruity, which basically means you have a worldview and the joke contradicts that worldview or threatens that worldview. And the extent to which you find it funny is the extent to which you find that contradiction to be benign or unlikely, so far removed from you or simply just not likely to be the case. That's okay, but what we can clearly see is they're all different. There are forms of theory that seem to be predicted by each well, but then others that don't seem to be particularly well predicted by them. So a better approach is a functional approach. What functions do we use humour in language, in discourse, when we talk to each other, when we're at a party, when we're at a pub, when we're hanging out with friends? And this breaks down into quite a simple 2x2 distinction. We can use humour for the self, for others, and we can use it in positive and negative ways. So the positive forms for the self are self-enhancing humour. That's using humour to alleviate my own stress. I might not really mind how other people find jokes, but I might just crack them because they make me feel good. Then there's affiliative humour, which is positive, other-oriented humour, what Lee used, which is basically there's no butt of the joke, but if there is, they're definitely not in the room, so to speak, and then it may not really be a threatening joke. Then the negative side is when it's self-oriented, is self-deprecating. It's when we take the mickey out of ourselves, when we put ourselves down for others' approval, in a sense. The other form is other-oriented and harmful, and that's aggressive humour. There's a lot of research leveraging this way of understanding humour. one of the most interesting findings is self-enhancing and affiliative humour is by and large good for men, for women, for everyone. Leaders who use affiliative humour, teachers who use it, friends who use it, all experience positive benefits. But there's something interesting that seems to happen with aggressive humour, with men in particular. Men who report using it in some studies, particularly the one that's cited on the screen, seem to experience more social support, which seems counterintuitive. So that formed the kind of background or basis for what we did. Bringing it back to the program, we were establishing this program in this feasibility trial, and we were going to do feasibility interviews with players anyway. So we thought, why don't we throw in another element to the study, which is, why don't we look at humour, or particularly banter. We wanted to get insight into the more contentious forms of humour, this kind of aggressive, playful distinction. So we applied a very specific analytical technique, which I won't go into too much, but it's basically the idea that people tell stories, but they draw on narratives. And these narratives are cultural resources. They circulate around us and they shape what kind of stories we can tell. It also assumes that people are meaning makers rather than, when they tell stories, we don't get perfect windows into their minds. The names on the screen, Arthur W. Frank and Brett Smith, Javier Monforte, are all names that have published some papers on this, if you are interested in looking into it a little bit. We had a few aims in the study. We wanted to look at what humour does for the men, what role does it play, when does it go right, when does it go wrong, but also importantly, we wanted to see how that's positioned within a broader experience in the program. We have to do this with a bit of a broad brush. So one thing we noted quite clearly in virtually all players' stories about humour or banter was that it was fundamentally a form of humour that blurs this line between playfulness and aggression. Irrespective of how they viewed it, virtually everyone described a kind of line that people need to navigate, where once you cross it, you step into bad territory. The thing was that was a very, very personal and subjective line for what exactly that is to cross. But we saw for a certain subset of people that banter did good things. One narrative that we could see that seemed to circulate among the stories of virtually everyone in the program, which we saw in our first study in the UK, was this idea of responsibility, of accountability, of being committed to the people around you. One particular story, an example of how this meant that banter could do good things, was told by Lucas. Lucas was quite a competitive individual in the program. He described himself as beholden to the scales, and as we said before, that competition can be a bit of a double-edged sword. What he noted was banter in a program like this in this kind of situation is a form of peacocking. So it's an element of showmanship where you establish your position in some kind of social hierarchy. But over time, that turns into, for these players, a verbal form of camaraderie, and eventually teams start to speak their own language. What he also noted, which was really important despite this, was that it can be inclusive, it can be exclusive, it can be offensive, it can be harmless, it can be absolutely everything. But importantly, it was something you wouldn't say in a formal setting. One of the really important elements of responsibility for Lucas was, in his own story, as a man, as a father, as a boss at work, as a husband, a lot of the guys in the program want to step into a non-formal situation where they can let their guard down. And one really important tool for doing that was using this form of humour, banter. This form of humour, banter, which goes all the way back to their experiences during their youth in sports settings. So it's quite an inbuilt behaviour, and it's quite a notable behaviour in contrast to how they would operate in their typical everyday professional life. What he also noted, quite importantly, was that it was a very interesting counterintuitive way of providing support. So if you were able to speak truth to someone by telling them something that could potentially be interpreted as offensive, but they interpreted it as a form of playful humour, so it's fundamentally an aggressive joke that they see as playful, then it was a way of them providing support. ultimately that person could develop perhaps the resilience to not be insulted by something that could cause them harm. Obviously, listening to that, there's a chance for that to be not such a good thing. And the flip side of this story, told by a player called Max, was quite, it's interesting because of the parallels between these stories. He also viewed banter as part of this social positioning that men use, but he articulated it in relation to this very interesting narrative of a changing progressive society that no longer views this kind of positioning behaviour as so acceptable. He says that it's almost no longer acceptable now because we're more educated as a society, we're now more accepting. Fundamentally, what he viewed that is, in relation to this idea of responsibility, his responsibility was to be a good member of the team, to be supportive to others, and that wasn't necessarily as compatible. What we can clearly see, this is kind of night and day in terms of how we interpret this social function. I might touch on that last point later if I get a chance, because I think I'm dragging on a bit. So we just have a few takeaways. Obviously, that was a little bit of a cursory overlook into humour, but a few questions are, is it good or bad? Whether it's good or bad, it's difficult for working with men in these kinds of contexts to perfectly balance these kind of competing perspectives. If it hurts some guys, should we try and legislate against it? I would caution against that, because doing so might drive away particularly hard to reach men who endorse more traditional views of masculinity, for example. So again, it's quite a difficult balancing act. What we should do is potentially we should encourage it, but also whenever we establish these forms of programs, we probably can't just try and encourage positive forms of banter, although that's a noble cause, but also recognize that some less positive forms might actually, by the intentions of the person behind the humor, actually be intended to be positive, but may not look it from the outside. It's all part of the language that develops in groups. That's pretty much it for my presentation, so thank you all.
That's great, Tim. Thanks so much for that. And just to dive even further into the point you spent a lot of time on there at the end, and quite rightly so. For many years in work on male-friendly services within the men's health sector, one of the common themes that we regularly talk about from a very practical and experiential perspective is the valuable role of humour and banter in working with men. So, on one hand, I'm going, yeah, we already know that, Tim.
Yeah.
But I believe this is the first time I've seen it presented in a research context. So it's absolutely, so I'm sitting there going, yes, it's so interesting. And that you've dealt with the nuance as well, the light and the shade. We have this conversation so often when training people about working with men, the role of humour to connect and build trust and build respect, but also the danger that it can isolate and damage and hurt as well, which is really, really interesting balance, which is I'm sure hard to measure and hard to teach, but it's a skill, and I think you've landed in a really sound place in terms of encourage it, yes, don't try and police it, but also be aware of its positive and negative aspects and how it can change for people in different contexts as well. So yeah, really heartening to see that piece of the jigsaw. As well as the general focus on the program, which is doing amazing work in how many rhinos did you say?
2 rhinos at the moment. There's tons of rhinos in the UK though. Many more rhinos.
May there be many more rhinos of that to come in terms of your work to reduce men's. It
would be nice to see more rhinos in the world.
Wouldn't it just? Yes, it'd be great if it could actually just offset men's weight to rhinos and sort of like resolve 2 problems in one go. I don't think it quite works exactly like that, does it? So again, comments and questions in the chat box, please. We are running tight on time, so we've covered footy, we've covered soccer, we've covered dads and daughters doing sport and exercise, and last but not least, I'm going to come to Dave Burt from SALT, Sport and Life Training, who does a range of awesome work engaging with men through community sports groups. Over to you, Dave, to give us a taste of the kind of work you're up to.
Well, thank you. Lee, I'm feeling very inferior because I haven't got a set of slides, and I've been taking notes from the three amazing speakers, and then I've been inserting their points into my presentation so that it sounds a bit more impressive as I go along. So I'll give you 20 minutes of a random collection of thoughts around the topic that I received, which was the perfect team. And so I wanted to try and put together what would that look like. But for those who don't know who I am or what the history of SALT is, we're 6 years old. We're a not-for-profit health promotion and charity, and we work doing education into sporting clubs. We're in 21 different sports. We started in just local football. When I say football, I mean AFL. You all refer to it as footy. It's kind of, you say footy, not footy. But it started in football. Before that, I was a teacher for 30 years and a sports coach. And part of the motivation was that I noticed that people that I coached, the young boys in particular, were at their very best when they were playing sport. They were courageous and sacrificial and determined and, you know, good communicators under pressure and so on. They were actually quite selfless, as we've recognised, because you ask them to come off the field, they'll sprint off the field, they'll make way for their teammate, they'll put a block on for their mate and take a physical hit. You know, if they're 15 metres out, they'll handball to the boy who's 5 metres out and give away the goal that they could have kicked. Yet I'd note that typically, you know, within school, they might sit in the back row and be disengaged with education or be rude to their parents, or they just weren't that consistent version of themselves outside of sport. And I used to say to people, can you imagine what our society would be like if we could harness the strengths, the commitment, the sacrifice that was going on the sporting field and get particularly our young men, I was working mainly with men, to apply that to their marriages, to their work lives, to their relationships. And if we could actually get sporting clubs to recognise that those wonderful things that they did off the field, on the field, if they could do those things off the field, if we could create clubs where there wasn't this emphasis on binge drinking, there wasn't this often sexualised attitude towards women, if there wasn't this view of, you know, hypermasculinity, and this was 6 years ago, and harden up, and if you've got a problem, you don't talk about it. And if our kids, you know, going into these sporting clubs could actually receive some tremendous kind of modelling and leadership from the older adults within those teams, this would be something wonderful for our society. And the other thing that led me to starting SALT was that I got asked to help out at a club that had experienced a suicide. And I have to mention this as part of the history of SALT, whereby I worked in actually 7 clubs over a period of 18 months who had experienced suicide within their clubs, to try and help those clubs to get back on their feet. And at every club that I went to, I heard a very similar message, and that was, we never saw it coming. We saw clubs who, after the event, were showing a real openness and commitment to one another, a vulnerability, and I could tell you lots of stories, but I haven't got time, about what we saw going on. But it had taken a suicide to elicit that. And so my motivation was, how could we get clubs to start having these conversations and developing this realness with one another without having a tragedy take place first. And only on Sunday night, I got another phone call from a club where a guy took his life on the weekend. I'm still involved in this more than I'd like to be. They said he got sent off the field on Saturday. He spat at an opponent. We'd never seen that happen before, and the leadership team gave him a dressing down because of his behaviour, and so they should have. But nobody actually said, you know, what's going on for you? Why this sudden rage from you? And he took his life that night, interestingly and tragically. And the week before, I was working at a club out in Greensborough, an under-19 group, St Mary's Football Club, where their captain of their under-19 team took his life as well. We did 3 sessions with that club. And before I get into what I'm going to share, I'll just share a few thoughts, but it was interesting because I had a group of under-19s there, and I was asking them how they were going on a scale of 1 to 10. 10 means you're coping okay, and 1 means you're really struggling. Most of them were really struggling, but what they actually said was interesting. They said last year during lockdown, we did most of our school online. So our social group really disintegrated. And now we've started uni, and most of that's online, and we don't get to see many people. And so coming to this football club is everything for us. And this really affirms some thoughts that I'd already had about the importance of sporting clubs that I suppose you all know. You know, there's a piece of research back in 2014 that said that typically we're 3 times more connected in a sporting club than we are at school or at work. And all the things that you've been alluding to, I think have been adding to that, the other speakers. But I just want to talk about our journey over 6 years. We've done about 2,500 sessions into about 21 different sports. And every sport is kind of different. I was out at the Collingwood Football Club this morning, not presenting to them, but in their one of their programs that they run. I had about 20 minutes in the waiting room this morning, and I was looking at some of their history around the place. And they had a really interesting thing, the Wrecker Awards, and some of their really tough players over the years have received the award for being really destructive on the field, you know, taking guys out and so on. And they wanted to highlight that, and I thought that was okay. I thought that was good because it was still part of that, you know, search for excellence on the field. But the thing that I found really interesting, there was a guy back in 2010 called Simon Prestigiacomo. Some of you might know if you're into footy. And in the 2010 grand final, just beforehand, he was earmarked to play against a guy called Nick Riewoldt, who for St Kilda was their star centre-half forward. And he pulled out just before the game because he had tightness in his hamstring, and he didn't want to let the team down. And there's his jumper on display, number 35, that this man was so selfless that he actually deprived himself of the opportunity to play in that grand final, which they ended up winning after a drawn grand final. But they've acknowledged him. And I thought, wow. And I took a picture of it because we're writing a course called Clubs with Heart. And what does it mean to be a club with heart? And I think there's 2 meanings of heart. And I'm coming back to this brief that I was given about what makes the perfect team. And I think on the one hand, they have their records. They're absolutely courageous. They're determined. They're relentless. They're ruthless in the pursuit of excellence. It's a bit like what Timothy was talking about earlier with humour. You know, where do you draw the line? This white line fever, where does it stop being fair? When it becomes, I think, win at all costs. But can you be absolutely ruthless in the pursuit of getting better, but also have that other element of heart, which is that we are sensitive, we're caring, we're perceptive, we're accepting, we're respectful. We ask the real questions. How are you going? How are you really going? It was interesting. I had a president the other day of a footy club, and he said to me, last year we didn't play a game and it was the best season we ever had. And I really thought, wow. He said, because we connected at a level that we'd never connected before. So I've got a few thoughts around, you know, the perfect team, and can we actually form something called the perfect team? And I just wrote down a few thoughts about what has to stay, what has to go, and what needs to be added. So here's just some random thoughts, and then maybe a couple of stories and some questions. We show a video of a guy called Neil Danaher. If you're reading the paper this morning, you know, he's dying of motor neurone disease. Most of you will know who he is, but every year he addresses the Melbourne Football Club. He didn't do it last year because of lockdown. He can't do it this year because he's too sick. He's actually lived 8 years after he got diagnosed with motor neurone disease, and the expected life expectancy is 18 months. But he every year up until 2018, he would address the Melbourne Football Club before they ran out against Collingwood to play on Queen's birthday. And he addresses that he was challenged, why don't you just tick off your bucket list? And he says, that gives me no satisfaction whatsoever. What gives me satisfaction is doing something for others. It's about meaning, it's about purpose, and resilience is a byproduct of that. And he goes on to say this in front of the players. He says there's a continuum. Up here is selfish and up here is selfless. And every one of you is somewhere on that line. And don't bother telling me where you think you are, because your teammates actually know. They know by what you do. And I think in really great clubs, and we're seeing a real diversity of clubs at the moment, those who are really getting it and want to be these clubs with heart, and those who still aren't. But those who are really getting it are realising that actually we can create an environment where people can be at their very best, where they use humour well, where they can be very committed to excellence, but that they can have this selflessness, which is totally counter-instinctive, especially in, you know, sort of 17, 18 through to 25, that formative age where it's still largely about us, but sport can bring that out like nothing else can. And Neil Danaher makes this point, and we show this video, but what has to stay? Well, my quick thought said the following: the courage, the achievement, the teamwork, the tradition and the legacy and the shared purpose, and the great use of humour or banter, as Timothy said, and a belief that our sporting clubs are inherently great places and that our strengths greatly outweigh our weaknesses. You know, I went to that St Mary's club, and we had Brad, the father of Charlie, who lost his life only a couple of weeks ago. And there was a little boy called Taj. He was about 14. He was younger than everybody else, but he was a close friend of the family. He was there, and he had his rat's tails, you know, his mullet. And when it came to sharing how he was going, he broke down because he was a close friend of the family. And he was sitting next to Brad, the big, strong, masculine father. And he started to cry, and I said, Brad, you can put your arm around him. And he did. He put his arm around him. And Taj rested his head onto the chest of Brad and just sobbed. And I wanted to take a picture, but it wasn't appropriate. But it felt to me like it just typified everything that was great about clubs in that moment. This was a perfect club. It was providing what was required. You know, what has to go? I'm not telling you things you don't know. The hypermasculinity. We know that hypermasculine males are overrepresented in every fatal statistic in our society. The dependence on alcohol and the fact that sometimes it requires alcohol to have that real conversation, that sexism, that old-fashioned definition of courage, that put-down mentality that Anthony was talking about in regard to humour, that Timothy was talking about, that sense of win at all costs. So I think we can be ruthless and relentless. And the Hawthorn and Geelong football clubs in their core values talk a lot about this. But it's not win at all costs. It's not win at the expense of hurting somebody else in a way that's outside of fairness or the right thing to do. And even that just lethargy or that acceptance of mediocrity. I was at one club where it was an under-19 group, and they were an elite group. They were in the NAB league, so they were the best league in the country, really. But a boy in the front row had tattooed on his toes the word chill, C-H-I-L-L. And I said to him, he was just sitting there at the start, I said, you must be pretty passionate about chill. And he goes, oh, no, not really. I said, you know, you've got 5 toes left, and if you wanted to, you could put on the word Excel, E-X-C-E-L. And he said, no, I'm just pretty chilled. And, you know, this morning I had this session, and it was with sort of 19, 20, 21-year-olds. And I asked them, you know, who are you when you're at your very best? And they mainly couldn't answer. And so I'd say, who's a mate of Pete here, or who's a mate of Susie here? And they put their hands up and said, tell me, you know, what's Joe like when he's at his very best? And they said words like, he's really inclusive. His humour really builds us up. But they themselves couldn't think of that. So I think really good clubs recognise the strengths of people, build them up, encourage people to be at their best and to rise above that mediocrity. And what needs to be added? We're working with clubs now around what is your story? And, you know, we heard a little bit about that story earlier, that importance of story. What is your story? How did you get to where you are? What's the story outside in the community about your club? What's the new story that we want to create? And how do we create that story? You know, what are the values that underpin that story? And how do we publicise that story? And how do we get sponsors or you know, people out in the community to support the club financially and in other ways that doesn't rely on us selling a certain amount of alcohol, having these nights where it's $100 when you come in, reverting back to $100 when you come in, that's all you can drink, reverting back to just the old tired ways of doing things, but doing things in a far you know, more creative way. And so what's the vision, what's the barrier, and what's the action? There's some good research about Vic Health around this and about really challenging some of that hyper-masculine context of clubs that still remains in some clubs, where Look, I have people ring me sometimes and go, oh, our committee, you know, how are we going to change the culture of our club? Because the president, you know, he was a legend in his day, and he, you know, he was the biggest drinker at the club, and we don't want our kids going in there. We don't want our 18-year-olds having their, you know, their values influenced this way. So Vic Health did some research around the whole hypermasculinity, and said that basically there's about 25% of the population of males that are still supporters of that. There's about 49% who are persuadables, they'll go either way, and about 26% who are real opponents of it. They want to see the change. But also, I don't know if you've listened to Zach Seidler when he speaks, he talks about the fact that very few men actually agree with it. They bow to it because of pressure, but nobody actually really particularly likes it. I think we need to really enhance the knowledge, the idea that older men can impact and support younger men, and that notion of responsibility, which is very appealing to men. If we go into a cricket club, which is a unique environment because you've got men in their 50s playing with men or boys in their teens. And if we say, you know, what kind of club do you want to be? If we ask really good questions of clubs, what kind of club do you want to be? What kind of impact do you want to have on your kids coming through? What kind of reputation do you want on the community? They'll answer you in very, very positive ways. And if we focus on who they can be, you know, clubs of excellence, what that looks like, and we give them great examples. We've been doing some work with two clubs, Grovedale and Barwon, Headsdown Geelong cricket clubs, where now they've got 100 people back at the club every night after the matches, and it's an even balance of males and females, and they are loving it. You know, there's still these clubs that are bemoaning the fact that we put on a keg and guys won't drink till midnight, and that's a bad thing. That's a good thing. So really great clubs are making a real effort at the moment to open the club up to the different demographics in their region. They're finding out who those people are. Who are the people types in their community? Who are the parents of the guys in their 20s and 30s still playing? You know, I'm a parent of kids now who are not kids, they're in their 20s and 30s. But as soon as my kids went from junior sport to senior sport, there was this notion that I was no longer relevant. Now, if one of the clubs that my kid was playing at said, we still want you involved, I would have loved to have been involved. I would have donated to the club. I would have donated in lots of ways, but they never kind of opened it up to me. So opening up this idea of who the club really is and how we appeal to a much wider demographic group. And then I think we just need to start instilling really proper good wellbeing and mental health systems. And we build into clubs what's called club wellbeing teams. And we work with them over 5 sessions online to be the eyes, the ears, the heart of wellbeing and mental health within their clubs. And to start really focusing on the positives rather than negatives. We had a club that made the front page of the paper because they had strippers at the club. It was a cricket club. And they had underage kids there and so on. I had to do a session there on respect and equality. They thought they were going to get told off, but I didn't tell them off. I just said to them, listen, what do excellent clubs do? And they gave me all the answers. I said, do excellent clubs have strippers? And they said no. So what do they do? Well, we started to just come up with some really great ways of running the club that didn't involve some of the tired ways that they'd done things in the past. So I think there's a number of things that we can do, and I'm getting to the end of my 20 minutes, but I'll just finish with this story. I catch up with a young guy who I've been seeing since he was about 18. He was a really good footballer in his day, and he almost got drafted, but he didn't. But today he's 25, and he has an alcohol addiction, he has a drug addiction, he has an anger management problem, and he has a gambling addiction. And all these things interplay. So if he drinks, he then moves on to cocaine. It costs him a lot of money. He starts to bet, and rather than betting $50, he bets $500. He's been working for 7 years and he doesn't have a cent to his name. And he has a partner who he lashed out at when he was under the influence of drugs. He gets angry and he hit her. And he's got an AVO over him now. And she got pregnant, and she had an abortion because she didn't trust him to be the father of her child. And he breaks down and he cries, and he's just so very embarrassed about who he is and so sad about who he's become. But he is a lovely, lovely man with a gentle nature that's, you know, lost its way. And typically when I see him, we try to work out a 6-week course of how we can get through the next 6 weeks, which means refraining from alcohol because it leads to everything else. And I say to him, what's the barrier? What's going to be the hardest thing for you over the next 6 weeks? And he says, on a Saturday night after footy when I go back to the club, that is the hardest environment for me to get through. And so we try to challenge clubs now. Are you still putting these barriers in the way of people like Jared, and they look and they realise that life has changed and that they don't want to be that club anymore. So what do we do now to create really positive clubs? So there's some of the things that we've been talking about recently in clubs who might want to become these clubs with heart, or, you know, you said at the beginning, Glenn, you know, the perfect club. I know that was a random collection of thoughts and stories, but that's just some of the work that we're doing. So thanks for listening.
Superb, Dave. As I would expect, I've learned a lot. Number one, good clubs don't have strippers. I've got that. Yeah, I've made a big note of that one. But yeah, I mean, some profound stories there, and you know, the stuff around mental health and suicide, and the stuff that you're dealing with really does demonstrate the potential impact that sporting clubs can have in terms of reaching out into young men's lives, into men's lives, into the lives of families and communities, and actually making a profound difference where it really, really matters around some of those whether it's from helping a bloke, you know, lose a bit of weight, make some friends, whether it's you know, helping dads to engage with their kids whilst getting fitter, build their relationship with their sons and their daughters, or whether it's actually taking on those big, profound sort of cultural change aspects, engaging men and boys across generations, and really shaping the whole culture, not just around sport, but in society in relation to a whole range of important things like violence and alcohol and drugs and gambling and all the rest of it. So yeah, we've covered a lot of ground, and you tied it up really nicely, Dave. So I just wondered if there's any questions from the groups. But whilst I'm just looking in the message to see if there are just any thoughts on the online space, Dave. We haven't. It's a question that comes up more often now than when we meet, because we've all got at least a year of experience of doing online stuff. I don't think we've really lent into it today. So, have you got any thoughts at this particular point in our lives about you know, the role of online in terms of engaging, just in terms of delivering service? You know, is it here to stay? Is it enhanced the way we do stuff? Is it getting in the way? What are your thoughts?
No, it's really enhanced the way that we do stuff. I think if we're going to work with clubs, and it's probably the same for most people here, we have to do some face-to-face stuff. Some of the things that we do just require that safe space that's, you know, less conducive online. But for instance, now when we're training our club wellbeing teams, and there's more theory and less opening up and you know, conversational type things, for getting information across, for training teachers, for, you know, showing video clips and linking one club to another and having them converse with one another about best practice, online is fantastic. I you know, I think it's all about the balance. We can't be all. It's great that we can do it this way, but you know, we can't rely on doing everything this way.
Right, perfect. Well, look, it's been great to catch up. Just a couple of comments about the amazing work, some amazing work you're doing. Says Kudzai. Nick says, what about men's health online conferences? I'm not sure where in the conversation that was mentioned, Nick. What was the context of that? Drop it in the chat box. Don't quite understand it. And one of our team earlier on saying he's very proud that Hawthorn Football Club is one of Dave's partners, obviously a Hawthorns fan.
I'd like to know who that is, if they come from Hawthorn, because I've actually got a session with the staff of Hawthorn Football Club tomorrow morning. So if that's somebody from there, hi, and I'll see you tomorrow.
Oh, cool.
Unfortunately, it's only a fan, Dave, but I'd very happily come along if I wasn't hosting tomorrow.
Yeah.
Thanks, Nick.
So the final point, I mean, having thought I was doing so well by even just referring to the sport as footy, when clearly it's not footy, it's got an egg-shaped ball, it can't possibly be footy. One last go. How am I supposed to say footy, Dave?
You just say footy. So the emphasis is not so much on the Y, footy, going up too high. Footy is somebody who didn't grow up in Australia. So just footy, just drop that Y very casually at the end.
Okay, here we go, folks. Footy. You fancy a game of footy, Dave?
That's it. You nailed it. Just footy.
Learning all the time. Yeah. Okay, perfect. Nick, I get the context of your comment now. You're right. Yes, good clubs don't have strippers. And what about men's health online conferences? Yeah, good men's health online conferences also don't have strippers. Nick, I think you actually know that. And looking at who's in the room, you really don't want this to end with any kind of strip. Funny, unless of course it was humorous, to bring us back to the piece about banter from Man v Fat. It's been a long day online, folks. Thank you to Tim, to Lee, to Eleanor, and to Dave for their awesome contribution to this session, reminding us of the huge potential of sport to engage with men and bring around all sorts of health change and cultural change. And it's an area I really still don't think we're harnessing nearly enough, which is why I'm always keen to have this as one of the topics on our agenda, to keep us thinking about what more we can do to use the wonderful world of sport to engage with men in terms of improving their lives and improving their health. Thanks everyone for your time.